Linda, as you know, and I am a lung cancer survivor. I've been a survivor for a year now, and I hope to say that I will always be a survivor. I came to Dr. Fata when I was in the hospital. I had had a pretty major surgery where they removed one lobe of my left lung, and I had that surgery on Tuesday, and I met Dr. Fata at 11:30 at night on Saturday night, the night before I was going to go home.
Wow.
And he came floating in at 11 o'clock at night and gave the bad news to me that I was going to have chemo, which I did not know that I was going to have. But he was so understanding, and so he was just kind of like a little angel that floated in the night. He sat on this stool, and I was crushed, you know, and he just handled it in a very compassionate way. He's a very caring man, and that comes out right away when you deal with him. Then the first time I came here to the clinic, I waited a long time, you know, and this woman said to me, "It's worth it." And it is, and it is. Dr. Fata is wonderful, and everyone here in the clinic is wonderful. I got to where I looked forward, honestly, to coming over here for my treatment. I mean, there was nothing to the treatment. The chemo after effects, of course, that's a different story.
Sure.
But when you came here, everybody welcomed you. They were warm. The nurses downstairs were wonderful, just wonderful. And so were the patients, and we kind of developed like a little fraternity down there, you know, where you'd come in. Sometimes you'd see people that you hadn't seen for a while or whatever, and it was, "Hi, how are you?" Whatever. Everybody likes to talk about their cancer. You know, some people that are not cancer people, they shy away from it. They sometimes won't even use a word. But down here, you know, we could say to each other, "Well, what kind of cancer have you got, or what are you fighting, or what are you going?" And people were anxious to talk, and so we did. I would be down there for maybe 2 or 3 hours, and the time would be gone, you know. And the nurses up here in the office were so wonderful, and you are so wonderful as a counselor for a screwed-up lady who can't figure out. Well, the hardest adjustment I had was leaving here, because this was my security over here. These were my friends. This was where I felt safe. I never brought anybody with me or anything. I always came by myself. The first time people said they want to do, "Shall I go with you?" or whatever. No, I said I want to do this myself. And I never regretted that. Because I just came in by myself and became a part of the organization, if you will.
This family. It's
it really, really is. I mean, that's an overused word that they use on all the TV shows and everything else, but you really are family when you're here. And a couple of times I have run into people that I met downstairs over at my pulmonologist. And I mean, it's like old home week. You're so anxious. You know, I mean, Dr. Alamaria just dragged me out of a room. Come on, get out of here. I've got work to do. So the biggest problem I had was leaving.
Yeah. And how is it now? How are you doing now?
It's been almost a year. Well, it's a year tomorrow.
Wonderful.
A year tomorrow that I had my last chemo treatment. And I had a big adjustment problem at the beginning. That's getting less and less. You know, I'm starting to pick through what I do want to do, what I don't want to do. I'm changing my life quite a bit. And I'm very happy with what I'm doing. I'm not racing around so much, you know. I'm enjoying my life a lot more than I did.
Yeah.
And considering the fact that I've got some pretty kind of serious problems with my one son, that's amazing. But I'm still able to have some peace and so forth, and enjoy my life.
Wonderful.
So, and I really thank everybody here for that. I really do.
Well, thank you for sharing it. Thank you for sharing this with us.
Yeah.